So person-centred care is something that I value quite deeply. By person-centred care, I refer to agency or voice being genuinely placed in the hands of the person receiving the support. So that is, rather than the organisation deciding what is best for their clientele, asking the person being supported what is it that they want, what is it that they need, desire, imagine, what do they hope for. So in the case of the community-based organisation that was working with vulnerable community members, the impact there was life-changing for that person. His previous trajectory was prison, and he was deemed in Brisbane to be a danger to society by the court. But with the team-centred approach, which revolves around collaborating and facilitating a meaningful life for him, he now lives independently and has a vibrant community to which he contributes and brings a whole lot of joy to many lives. In fact, he was at our wedding and he was one of the highlights for many people. And we're overseas for the last couple of years. He regularly Skypes in, so he's just a real delight to be with and around. So as far as what was meaningful for him, a sense of having a valued role in society was really important to him, being able to be connected to other people and to be able to have fun. And when he had those things in his life took on a whole new trajectory. And I think that was really beautiful.
It's really important that we don't make any assumptions about the patient. Sometimes, especially when you get through your studies, you might start to stereotype patients with a certain medical condition that might not be totally fair. You might make assumptions about what they look like. And certainly that's something that has caught me out in the past. Working in the hospital, you have patient bed lists where you have a list of their medical conditions. You've got a list of all their numbers and digits. But when you go and look at that patient and you speak to them, the picture can be entirely different. So recognising that every patient is entirely unique and speaking to them about what their position is so important in informing you as a clinician, because you can't get all of the information you need to actually care for that person properly just by looking at a piece of paper. The other thing is that if nothing else, they can be a really important safety check. So when things are going wrong for the patient, they will be one of the first people to point something out, and there have been well-documented cases within the hospital, outside the hospital, where this has gone wrong because people haven't listened to the patient. And one example of that is Ryan's Rule, which we have in Queensland Health, which basically the upshot is that if you don't listen to the patient, you don't listen to parents of the patient, carers of the patient, their family members who really do know that person, you could be looking at a potentially fatal situation. And that's a really dire, extreme example of it, but we really have to listen to the patient's perspective to make sure, yes, we're preventing harm, but also that we're making the right clinical decisions by the patient. So we really have to take a step back sometimes from what we would like as clinicians or as health professionals and take on board what the patient has to offer to us.
So person-centred care, in my approach to practice, I would say is really looking at the individual and their needs, and I was listening to them, as opposed to having strict boxes that if someone doesn't fit through, you don't take them on, or you work only in a particular way. Particularly in our service where, one, you're working with teenagers, it doesn't really work like that, just because everyone's different. It's really about taking your time, and just through that just shows the love that you have for the job.
all of us in the team talk about what expertise we bring to treatment. So as one of the psychologists on the team, I bring some expertise in eating disorders and psychology, but we make it very clear that what the client brings and the family brings is their expertise of themselves. And so we're, I guess, really emphasising that fact that there's something here that needs some work and some consideration, but it's going to require both of our efforts, and we're both going to be looking at it from different angles and collaborating. We try and get feedback from clients throughout the course of treatment. So through iPads, we do some between session monitoring, we send out surveys, and that's us always inviting them for their input as to how they think things are going for them. So yeah, we definitely try and involve the clients in their treatment because we see that, you know, they are one of the experts.